Um, William loved to read many of Albert's novels, and he even based one of his own books' point of view from his. Um, as William became more known throughout the Americas and England, Camus read one of his novels and decided that he wanted to meet him, and so their mutual friend Roman Gary set up a date so they could have dinner together and exchange thoughts on each other's books. But before William could meet him, he found out the devastating news um, that Albert had been in a terrible accident that claimed his life. Um, but but William kind of had an idea that Camus had been dealing with the same depression that he has from his novels, because it seemed to be an underlying issue of depression and suicide that hinted to the fact that maybe Camus uh, was dealing with that type of symptom and was about to claim his life, maybe. Roman Gary, their mutual friend, uh, his wife, Jean Seberg, was also suffering from depression, and it was so evident because she would just walk around and just seem like she was a zombie and such in a trance like state that she couldn't even talk to anyone. And it was also noticeable when she overdosed on pills and it killed her. And Roman Gary, her husband, was so overtaken by all the grief, and so it just increased his depression and eventually led him to shot himself to stop the madness. Depression can hit people of all ages, races, creeds, and classes, but women are at considerably higher risk than men. From William's own findings, he notices that the artistic types, like poets, are more susceptible to this disorder. Textbooks also state that this psychodynamic theory that set no that this psychodynamic theory that people whose childhood needs were improperly met are particularly likely to become depressed after experiencing loss. Depression takes upwards of 20% of its victims by way of suicide. William can tell that his mind is heading for a mental breakdown as he describes it. Although as an illness, depression manifests certain unvarying characteristics, it also allows for many idiosyncrasies. I've been amazed at some of the freakish phenomena not reported by other patients that is wrought amid the twistings of my mind's labyrinth. Although William had his suspicions of the development of his disorder, he never truly knew what caused it. Multiple factors can sometimes be the reason for developing the disorder, but usually this can just lead to many questions unanswered and just be a lost cause. William dealt with years upon years of alcoholism, and he often said that it was a way for him to get away from the real world and go into some fantasy place where he could imagine and dream, and just it would really help his novels and help him be really creative. He always made sure, though, not to be drinking while he was writing his lines, though, because then it may affect his work and may not make him credible. As William looked back now, he saw that he drank daily just so he could calm his anxiety and the initial dread that he had hidden away for so long in the dungeons of his spirit. When he gave up alcohol, he expected his body to just reject it and let him live a happy life, but instead it sent him into a mind-boggling spiral to the depth of his soul. He was at his summer house on Martha's Vineyard when his emotions started to go awry. He had feelings of numbness to his surroundings that stole his happiness and pleasure from each beautiful day. He felt like his body was becoming frail, oversensitive, and somehow disorganized and clumsy, and was lacking normal coordination. He never felt normal because there always seemed to be a cloud of anxiety attached to him. William saw the true extent of his disorder on a trip to New York when he had his first dose of alcohol since his relapse. He had a scotch and cola, and so it immediately sent him into a nosedive of interior doom that sent him to the hospital to run some tests. To his dismay, the tests showed nothing and just basically told him that he was perfectly fine. After that episode, he returned to his house in Connecticut, but couldn't escape the gloom that followed his every move. Even with his wife there with him to comfort him, he still felt lonely and just worthless. While he used to write in the afternoons, as the disorder progressed, his writing soon just stopped altogether. His anxiety was starting to increase with each day of the disorder as well. He said that he had some strange events happen to him daily that would make him realize his depression was getting the best of him. Like one day when he was walking his dog, he heard some geese above him in the sky, and usually people just look at it or just feel happiness for it. But for him, it made him feel really anxious, and it made him stand there just motionless in fear. All William was thinking about at this point in his disorder was the famous line of Baudelaire's, "I have felt the wind of the wing of madness." William's sleep patterns were far from normal. His 2 or 3 hours of sleep were at the command of the halcyon, a tranquilizer drug in the benzodiazepine family. It also includes Valium, Ativan, and others, and they are capable of depressing mood and even precipitating a major depression. He, previously before the halcyon, he had an occurrence with the Ativan as a sleep aid, and his doctor told him that he could take it as casually as aspirin, when in fact it was 3 times the normal prescribed strength. It was not advisable as a medication for more than a month, and it was to be used with special caution with people his age. After that, he started to take the halcyon, and he was soon becoming addicted to it, and he was consuming large doses. He believed that this was also the reason for the onset of the disorder.